today's webinar on using a special program to improve health and digital literacy and involvement in patient care. It's about self-measured blood pressure hypertension control program. Cheryl Thompson is here and she's going to talk to us about this program. We're going to do a formal welcome in a few minutes, but we're just letting everybody come in here. So again, welcome everybody, and we'll get started in just a minute. Hello, everyone. Welcome to our webinar. I think we are got people in well enough, so we are going to get started. Hello, my name is Julie McKinney, and I am the list moderator at IHA, and we are excited to welcome Cheryl Thompson here, who will talk to us about using a self-measured blood pressure hypertension control program to improve health and digital literacy and patient involvement. We're really excited to have you, Cheryl. I'm gonna introduce her formally in a minute, but just a few very quick points of housekeeping. You are all muted. If you have a question, please put it in the Q&A box at the bottom there. That's where we'll be collecting questions that Cheryl will answer for the last 10 or so minutes of the time. And if you want to chat and share with other participants, please use the chat box. The default is on hosts and panelists, so if you want to send something to everybody, just change that. The session will be recorded. The slides will be available along with the recording on the IHA webinar page probably in a few days. And if you're having technical issues, I'll put the email in the chat. Hopefully that won't be a problem for most people. And then for those of you who are looking for CE credits, you'll get an evaluation emailed to you, and once you fill that out and submit it, you will get your CE credits. So all of that should be familiar to everyone. And let's see, I guess I think that's it for housekeeping. So let me tell you about Cheryl. Cheryl Thompson has been in the field for a while now. She is co-director of the Institute for the Advancement of Women's Health and co-director for the Institute for the Advancement. Oh wait, that's the same. Sorry about that. She's also senior public health analyst at the U.S. HHS Health Resources Services Administration, where she leads a team that supports the development and training technical assistance to health centers on infectious disease and community health. Before her current position, she served as a public health advisor to the U.S. HHS office, that's Health and Human Services, on women's health, working on health topics as varied as opioid misuse and addiction, overweight and obesity, intimate partner violence, trauma-informed care, heart health, HIV/AIDS, and female genital cutting. So Cheryl, you have worked in many different high intensity aspects of women's health and people's health. So I'm sure you have a wealth of experience, and we are happy to have you share this piece with us today. So with that, I will let you take it over, Cheryl.
Thank you. I hope you can hear me clearly.
Yes, sounds good.
So good morning and good afternoon. Thank you so much for the introduction, and thank you for allowing me to present today. It is great to be presenting during Health Literacy Month, and throughout this entire month, it looks like IHA is building awareness through action. So it's an honor to be able to present this month. Thank you. At the Institute for the Advancement of Women's Health, we like to infuse the improvement of health literacy everywhere that we can when we develop programs, because we know just how important it is to improve health literacy for people, for their own care, and for the caregiving that they possibly will be pressed into service for. So let me tell you a little bit about the Institute for the Advancement of Women's Health. We are a 501c3 community-based nonprofit that works in the area of women's health. And we like to broadly define women's health beyond sexual health and reproductive issues. We conduct and apply community-based public health research, and we are proud to honor our obligation to teach, educate, and lead people to become more knowledgeable about women's health and better inform participants in their own health and well-being. So this is the agenda. This is how we'll spend our time together. We just did the introductions. I'll introduce the issue which is hypertension control and management, the motivation behind our program. I'll walk you through the development of our program and the many components of it and how they work together. I will outline some brief outcomes and then leave you with some lessons that we've learned and some takeaways. I have no disclosures other than what's already been mentioned, that I do work for the Department of Health and Human Services by day, and by late afternoon and night and on weekends, I am definitely the co-executive director of a nonprofit. So these are the learning objectives for this afternoon or this morning for you. By the conclusion of this session, I hope that you'll be able to replicate any part of this modestly budgeted evidence-based community-based program that will help improve the health and digital literacy of your clients or patients or participants. Hopefully you'll be able to capitalize on the increased sense of awareness and support that ancillary primary care support like this program can provide to foster the improvement in patient and provider engagement. We find that that's really important. And then hopefully you'll be able to integrate no to low cost digital platforms that we use for this program into your patient care or wellness programs if you so desire. Okay, so the issue. It's a big issue. So in 2020, more than 670,000 deaths occurred in the United States that had hypertension as a primary or contributing cause. And nearly half of adults in the United States have hypertension or are taking medication for hypertension. Only about 1 in 4 adults with hypertension have their condition under control. And in the US, nearly 58% of Black women have high blood pressure compared to about 41% of white and Hispanic women. So what's the motivation behind the program that IAWH has developed and executed? Well, it looks like it's for us, it falls into 3 categories. So for me, it's personal. The women on the left in the first circle are from my family unit. The very robust woman on the left, that's my grandmother, Emma Smith. The second or the third woman over from Emma is my mother, or was my mother. And the baby sitting on the lap of my great Aunt Jane is my older sister. I don't know who the other 2 women are, but they must have been family members. And there's a line of high blood pressure and hypertension that runs in my family. And there's probably, it's a good bet, that hypertension ran in the community and the circle of women that ran together back then. Secondly, the community-based angle. For my entire adult life, I have lived in the Washington, D.C. metropolitan area, whether it's Maryland, Northern Virginia, or right in the heart of D.C. And that's a very ethnically diverse and rich community where many of the people fall into the category of being at risk for hypertension for a number of factors. The third reason for the motivation for this program came in 2020, the Surgeon General's national call to action around hypertension, where he asked for communities to get involved in the reduction of hypertension and the reduction of the percentage of adults with hypertension, as well as the number to increase of the people who have it under control. So there's 3 motivating reasons for the development of the program that we've started. So the program, we decided to call it SMBP Hypertension Control. It's very plain, very straightforward. And we started to build the program. It took us a while to get started. It actually started pre-pandemic. And when everything shut down and people began just Zooming and communicating virtually everywhere, we figured we'd have to shift everything to online. And it was a pretty easy lift to do that because people were getting so used to doing that already. So what we had to do, number one, is scope out the project, set the goals and objectives, pick the target population, and develop what would become the program components. And you all probably know about all this if you do program development. We had to locate Bluetooth home blood pressure monitors, and that became a bit of a challenge. Looking around the community for businesses who would actually help us purchase them, looking to see if we could purchase them in bulk at some kind of a discount. But we were very fortunate to find out that the Medical Society of Virginia had a program that was just perfect for us. Thirdly, we had to identify and recruit our professional team and define their roles. And you'll meet them shortly in slides coming up. We had to recruit professional partners who would be willing to do this evidence-based teaching and learning at low to no cost. We had no money for honorarium. So we had to get really strong partners and people who were devoted to this topic. And then we had to recruit program participants. And this was really important, making sure that we had the right people in the program, people who were capable of completing a 6-month program, and people who were just enough technically savvy to be able to have an interest in learning more about digital literacy and learning to improve their skills. And then finally, executing and managing the program and dealing with program add-ons. So we immediately went out and developed this webpage so that we could send people to this page so they could apply for the program. Everyone who was interested in the program was not accepted. You had to have at least some of the basics covered. First of all, you had to live within the region primarily. You had to have been diagnosed with hypertension formally. You had to have a primary care provider. You had to have at least a smartphone and some interest in technology. And you had to express that you were willing to commit 6 months of your life to doing the best that you could in this program. So these are the goals. This is the one goal and the objectives that we set for this program. To learn to use SMBP monitoring along with education and support activities provided by our program to help learn more and understand about hypertension and learn to manage the condition. That's the one goal. A lot of people's goal targets sort of wandered throughout the program, and then we would have to center them again. This is the one goal. Some people decided along the way, well, my goal is to get off of medication. Well, that's fine. But the main goal for this program is this. And if by following this program, you get to the point where your primary care provider says no more medication, that's beautiful. But we wanted to keep people targeted and focused on this particular goal. And anything else, weight loss, reduction in cholesterol, any other chronic condition, beautiful. But this is the main goal for this program. And then, of course, there are objectives to the program: better understanding of the condition, causes, methods of therapy for management and control, which includes medication, which a lot of people have an issue with. Knowing how to properly take your own blood pressure with a monitor at home. Knowing how to use and understand Bluetooth technology to record and share health information. To understand the role of diet, nutrition, and physical activity in blood pressure management. And of course, improve the health and digital literacy. So these are some of the partners and people. We had representatives from some of these places that participated in our program and support our program. We have some additional partners now with the University of Michigan and Cleveland Clinic just recently. So we're excited. that we have individuals and organizations who support this work and are happy to join us in our effort to improve numbers around hypertension and improve people's health and digital literacy. So this is our team, and our team is completely voluntary. Like I said, we had no budget for this particular program. We just wanted to make it happen. You can find some really wonderful volunteers through, I believe it's called Volunteer Match online. It's a platform where people put their skills and the kinds of work that they're interested in contributing to and supporting. And so we did a number of interviews, a number of tryouts until we got just the right fit. Dr. Abby is a physician and a small group lead. Dr. Simi is a physician and small group lead. Abby lives in Arizona, and Simi practices in Florida and California sometimes. Melissa is our writer and editor, and she was in Buffalo, New York. And Nancy is our data analyst, and the amount of data that she processes and analyzes is incredible. And she's in Nairobi, Kenya. So of course we all work remotely, and we are a really good fit. So these are the monitors that the Medical Society of Virginia donated to us. They're the Series 10, I believe, of the Omron ARM monitors. And there's an app that goes along with Omron monitors, the Connect Omron, that allows you to interact with your readings, and to transmit them electronically using your smartphone. And so we've had sessions with participants on how to set up your monitor, how to sync it with your smartphone, how to transmit readings, how to understand your readings, et cetera. So the Medical Society of Virginia donated as many monitors as we needed, with the agreement that we would share our data with them in the end. And we have two cohorts of participants in this program. And we've already shared the first cohort 6-month outcomes, and they were fantastic. There were great strides made during that first 6 months. So program recruitment, this is always fun. Making sure that you get the word out and get it out to the right people. And so we had a great time with our website, sending out the link to people. We went to churches. We talked to local chapters of the NAACP. We went to libraries and posted things on bulletin boards, community boards. We used social media a lot. We reached out to our subscriber base for our organization. And then we used community radio, which was really very helpful. So we did a lot of outreach, sent people to our website. There's a website again, and then pulled together 2 cohorts. The first one ran from January, and you may remember that was at the height of the second surge in the pandemic. And we weren't sure that very many people were actually going to be able to do this and carry this out. But we took really good precautions, rented a space at a community college, and had people come in at a few at a time where we could work with them individually, get them set up with their monitors, make sure they were comfortable with how to transmit data, et cetera. And it went smoothly. So these were people who were completely dedicated to improving their health and their health literacy and digital literacy. So 2 cohorts. The second one runs from July to December, and as you can guess, it's still ongoing. Okay. One component of the program is called the Lunch and Learn. Midweek, either on a Wednesday or a Thursday, from 12 to 1, a health provider, a researcher, someone who has subject matter expertise in the area of cardiac, cardio health, heart health, and hypertension, and other multiple chronic conditions, is a speaker. And they address questions, they make a presentation, and answer all kinds of questions from the participants. Our only ask of them was to treat this group like you would treat a class, and they love it. They loved it. They loved it when we told them that, because they switched off from their clinical provider mode and went into teacher mode, asking, do you understand what I'm talking about? Do you need me to define any terms for you? Do you need me to back up and start over again? So they take a special touch to these lunch and learns and turn them into classrooms of learning. So these are some of the presenters that we've had already, and some people will be doing second rounds because they have enjoyed the interaction with our group and the mission that we're on. Everyone listed here, let's see, just about everyone has already spoken once. Ashley Gerhardt was our very last speaker from last week. She did a session on food and addiction and how foods that we eat have an impact on our health. And all of this information together is giving people a more wholesome picture of their health. In December, we'll be talking about sleep disorders and how important sleep is to health and to heart health. So the small group is another component of the program. The small group is run by Dr. Abby and Dr. Simi that you saw on the previous slides. It's a monthly meeting, and it happens at the end of the month, the last Saturday of every month. They are health professional-led meetings where discussions can range from what was discussed in the last Lunch and Learn to, I have a new prescription. Can you tell me more about what this is? Because my doctor really hasn't said too much. It's an opportunity to engage, to challenge, and to educate. And they last for 90 minutes. People usually look forward to the small group topics. So these are some of the topics: understanding your medication, managing multiple chronic conditions, the foods we eat and why. And at the end of the 6th month, there's a health literacy game show with prizes. And the team leads lead the game show. And it's amazing with buzzers, the whole bit, and people really get into it. A few weeks before the actual game show, we tell people you better start studying up. And then, people start sending in little taunting messages to one another, like, I stayed up all night studying, you better look out. One session in particular that stands out in my mind was understanding your medication. Dr. Abby did a session on the different classifications or classes of antihypertensive medications. And it was just riveting, the way she broke everything down for people. And some people were actually led literally to tears. They said they had never heard medications broken down that way. They never knew why they were taking medications. They never knew how they reacted. They never knew how they acted in the body and how they helped their body beat back the high blood pressure. So some people, even in their applications for this program, expressed that they rarely had conversations with their primary care provider about hypertension. They had been prescribed medication and just have been on it for all of their lives, and they never understood what was going on. So when we can do a breakthrough like that, that means a lot. We have a newsletter that comes out every other Friday, and it's called Taking Control. And oftentimes it's a summary of the lunch and learn that we had that month at some point in the recording, reminders for upcoming events and activities, links to educational resources. We feature participant health journey stories so that people can share their challenges and how they've overcome things when they were diagnosed with hypertension, how they've been managing it, how they're managing other complications that they may have had, and even how they pull in their family into their story. We like to include recipes, and those are always fun when they're videos. People sometimes share that they've tried out recipes, sometimes good, sometimes bad. And then Melissa, who's the writer-editor, does a lot of plain language translation of evidence-based research on some of the more recent and up-to-date literature. On the other Fridays of the month, we send out a simple email called 3 Things. And that's 3 things that we want people to ponder over the weekend, to add to their knowledge. Whether it's an article, like weather can have an impact on your blood pressure, or getting people to start thinking about how to combat stress during the holidays, doing it early, just preparing yourself for those stressful situations so that you can avoid spikes in your blood pressure, et cetera. And then this last one, we're going to have a team's steps challenge. So everyone who's on Abby's team is competing with everyone from Simi's team through Thanksgiving. And then we'll probably award team prizes. We do quizzes to help people test their knowledge and to get them to learn more. This is an example of a quiz. It's just built on Google Forms. And we like Google Forms because in the process of grading getting your score, you're able to insert resources, links to further people's knowledge and curiosity about a particular topic. And so we do quizzes and we like them because it's an opportunity to advance people's learning yet again. This is another quiz. This was one, was more visual. You can't see the whole thing, but it's asking what's right here and what's wrong here in terms of the way that people were taking their blood pressure. Were they sitting with proper posture? Did they have their legs crossed? One woman in a picture was actually on her cell phone smoking a cigarette. So just getting people to focus on the things that are not correct and stating how they can correct them. And then this is the game show I told you about. We really love the game show when it comes up. So everything is not about literature and reading and transmission of data, et cetera, et cetera. But we do have group physical activities. And just about a month ago, we were out in the park doing group hula hooping. You know, it's physical activity, it's not exercise. It's just a way to get out and move your body. So a bunch of us with an instructor was teaching adults how to hula hoop again. And we had the most fun. We've done yoga sessions, we've done meditation sessions. In the bottom right-hand corner, everybody has on a hood and a jacket. We were out there in February doing a group walk and exercising, just like doing stretching exercises to start us off before the walk. And then in the spring, we had a group out in another park learning Tai Chi and some basic Tai Chi movements that you can incorporate into your daily life. So here's an add-on, and this is where the fun starts. We started without this app, then we added it into the program because we figured we could do with a whole lot more data to tell people their whole story and not just looking at their blood pressure numbers. So we started using this app called My Data Helps, and it collects wearable data from your watch or I believe your ring, though I don't have anybody in the program with a ring, but your Fitbit, your Apple Watch, your Samsung, and your Google Watch, whatever kind of device you have on, if it's Android, we can collect that information. So we wanted to collect people's number of hours of sleep, the amount of physical activity that they're engaged in the week, the number of steps. And what's really great about this app is you can insert survey questions for people to respond to. So this is an example of some of the survey questions. Are you mostly happy with your food choices last week? Yes, you get a fantastic. No, you get an encouraging message that says, better luck next week, or try better next week. There's always next week. Are you happy with your blood pressure measurements this week? Did you take all of your medications every day this week? Congrats, keep it up. Or if you need encouragement, you'll do better next week. And then we want to know about people's stress. Do you suffer from stress? How often do you experience stress? What kinds of things do you stress about? And what do you do when you're stressed to relieve it? Do you experience stress more now than in years past? And then we thank people for always taking the surveys and provide them with a link to further information on whatever topic it is that they're being surveyed on. So other questions that are in the survey series include reading food labels. Do you read food labels, and how often do they impact what you eat? We can send medical terms, and we do. We set them up and have people try to define them using multiple choice. We send short videos for people over this same app so that they can watch them, and then maybe be encouraged to watch the full video. We ask people to take photos on this app, or a short video, just a video of proof that you're actually out walking, doing some kind of physical activity, or take a photo. What is in your pantry right now? You know, don't change anything. Don't take anything out of your pantry. Just open it up and take a picture so that we can see what you're working with at home. And then, do you share the information from this program with your primary care provider? Every person who is successful receives the certificate of completion, and it just shows that they have completed the program and have reached, have satisfied the one goal and addressed the objectives of this program. So quickly, let me go through some quantitative outcomes. So for the first cohort, we had 32 participants, 32 women and 1 man. 29 is the number of participants with a decrease in systolic pressure and 13 in diastolic pressure. So 81% is the percentage of participants with a decrease in systolic pressure. And that looks like a drop of 13 points systolic for the decrease. And then 62% of participants with a decrease in diastolic pressure, that would be a decrease of 10 millimeters of mercury. So these are the add-on outcomes, meaning the responses and data from the My Data Helps app. This is really distilled because the amount of data that program produces weekly is out of this world, an amount. So we had 97% of participants respond to the questions about reading labels and having them impact their food choices. 97% of participants attempted, this is not saying that they were right or wrong in defining medical conditions or medical terms. 96% of the participants accessed to view the videos that we post on My Data Helps. Only 40% of people wanted us to see what was in their refrigerator and in their cupboard. And then 100% of the participants said that they are sharing the information from this program with their primary care provider. And so just to be clear, not all of the participants have enrolled in My Data Helps for whatever reason, whether they didn't want to share their data or they just were uncomfortable with all that it takes to be interactive with the app. They did not all enroll. So this is something that warms our heart when we see this in real time. This is an actual, this unsolicited email that we got from one of the participants. I went to see my endocrinologist on yesterday, and my BP was 138/82. And you're saying, yeah, that's still high. But this person came in with the highest blood pressure that I'd ever seen, to the point where we were constantly telling him to please be in touch with your primary care provider now. But this is actually the lowest that it's been, and it's moving in the right direction, and he is very engaged. This is the lowest reading I've seen since July. Blood glucose was 96 and my A1C was 6.1. I've also lost 10 pounds since late June, which may not sound like a lot, But for someone like me who had been gaining weight yearly before this program, I am so happy. I am just so grateful for everything. So that just makes me feel good. Some qualitative outcomes. These are mostly quotes, and they are unsolicited quotes that come in after programs, quotes that come in just randomly. Thank you for this program. I'm learning a lot. Small group was great today. My doctor never explained things this way. Lunch and learn is just not long enough. Excellent lunch and learn. I enjoy participating in the game. It was fun-filled and I continue to learn a lot. I'm telling you, that game is something. It's very competitive. To my surprise, I can't believe how much we all retained over the past several months, how much information we've all retained. So, some lessons that we've learned, and these probably will be familiar to you if you have developed other programs and executed other programs. Participants can benefit from more hands-on interaction and attention. And just because we were working within a pandemic, it became difficult to provide that hands-on interaction and attention. And we've learned from the first cohort moving into the second one, where people are a little bit freer and more at ease moving among each other. We've held several sort of technical assistance sessions around the area in public libraries, where people can bring their devices, bring their phones, bring their laptops, et cetera, and we can help walk them through the situations that they're encountering. Number two, technology can fail. Probably should say technology will fail. And we've had failures in technology, things coming unsynced, people panicking because they are afraid that their numbers won't be able to transmit. Prepare for some persons to disengage and revert to the manual capture of their data. And we've had a couple of those people who just said, I can't deal with this right now. I'm just going to have to write down what my readings are daily, type them into an Excel spreadsheet, and then I'll send it to you. And that's okay, because we meet them where they are, and when they're ready to move back into the digital world, we're there to help them. And then people come with different levels of literacy, both health and digital. And so that's still meeting people where they are and beginning to work with them until they're more comfortable moving to the next level. And this is the final slide, the takeaways. Things that we've done that have been successful. Create an atmosphere and an environment of open communication, advocacy, and community support early. There's so many people who are involved in the first cohort who wanted to stay involved and bring people along in the second cohort, because they really enjoy the community, the accountability, the checking in with each other. Make learning fun, but measurable. Use light competition like we do, games, quizzes, polls, and incentivize things. Sometimes we give away gift cards. Gift cards to stores like Mom's or Whole Foods or Trader Joe's, where we think people will make better choices for food. As your program advances, create situations where more knowledgeable participants can lead and demonstrate. Early on, we found out that we had some computer whizzes and some tech whizzes among us. And so we called on them to help bring others along. Host training and technical assistance sessions so that participants can witness and demonstrate the use of technology. It's always really helpful. Make best use of experienced volunteers, graduate students, student interns, and contributions from the community. Our organization actually has support from the American University Public Health Scholars Program. We have 2 students working with us currently, and they're a big help in supporting this kind of work. And then finally, word of mouth is the best promotion for this kind of community-based experience. We did all kinds of outreach with organizations and churches, But the word of mouth from the first cohort to the second cohort was amazing. People brought in their sisters and relatives that lived outside of the region because they wanted to buddy up and have accountability, and the numbers continue to grow. So thank you for your time and attention. And I guess we're at the point where if you have questions, I can attempt to answer them.
Thank you so much, Cheryl. That was, first of all, we're getting all kinds of kudos in the chat. People say it's a great program. We're so lucky to have found you and heard about this. So lots of positive feedback, which I have to agree with. It's it seems like the program used all the elements of adult education that I've ever learned, and all of the elements of creativity and meeting people where they are. I mean, it seems like you did everything exactly as we always hear things should be done. So that's really, it's so nice to hear this. And your explanation of it was just so clear and easy to picture the program. So sorry for going on about that, but we do have a few questions.
Okay.
One person wants to know, do you use an EMR to receive the blood pressure readings? And if not, what did you use to collect the information?
No, we don't use the EMR to collect them. Each person is responsible for taking their blood pressure multiple times a day. And then at the end of the week actually the beginning of the next week on Sunday, most people send in their readings to IAWH, where Nancy, who is our data analyst, has created files for each person where she's collecting the data and trending it for people so they can see how their progress is from week to week and across the 6 months.
Okay, great, thanks. Okay, also, someone wanted to know, how were the group physical activities decided on, like the yoga and Tai Chi? And were the participants taught how these activities help with blood pressure control?
Yeah, so the activities were chosen. I don't remember how exactly they were chosen, but some of them were voted on, like the hula hooping and the Tai Chi. And the activities were, everything except for the group walk was led by a fitness and health instructor. And so those people who were leading the sessions actually did talk about the benefits of physical activity and how it impacts heart health and can improve blood pressure, high blood pressure.
Okay, thanks. Let's see. Someone wanted to make sure that, could you send out your email to contact for additional questions and maybe a list of the apps to help with patient monitoring? And then also, are there bibliographic references to this program? So if you don't have to answer these now, Cheryl, we can get that information and make sure that it gets out to the group. So yeah, but that's what people were hoping for.
There's a participant's guide for this program that we created. And so there will be citations in the guide, and I can send you the link to that guide so that people can.
Oh, that would be great. That would be fantastic. Thank you. Yeah, so everyone just know that we will send that information out, and the slides and the recording are all going to be on the IHA website soon. So you'll get all that. People who are interested, they liked your slides. And I have a question. It sounds like you your community building within the cohorts was really thoughtfully done and done well and made a difference. So I guess I'm curious as to how you think that sense of community, how much that was responsible for the improvement as opposed to just the monitoring of the numbers and so on.
I think that the community is really important. There have been people who have been complete strangers that found each other and to this day continue to do morning walks and physical activities together.
That's
So I
great.
think that that's really important, an important piece. We got to the point where we had to create sort of a bulletin board, and like electronic bulletin board, so that people could post things that they encountered
Mhm.
online or post activities. You know, someone will say, I'm going to do X, Y, and Z, or I'm going to a girl trek walk this Saturday. Does anybody want to join me? So
Mhm.
it feels like there's a need for people to have community. And when there is community, it feels like people do a lot better than going
Yeah,
somewhere.
yeah, no, I mean, it seemed like this really, I mean, it doesn't sound like you had much attrition, so it seemed like people who were there stayed, and that's the
Yeah.
testimony to
And so
it.
even the people who were having difficulty with the technology stayed,
Mhm.
because they were gaining from other aspects of the program.
Yeah, right, right. No, and it just, I think it also, it just shows how important it is to bring those community building activities, you know, like the games and all of the stuff that you've been talking about. It seems like that's just such an important element of a program, and you did it very fully. So that's a good lesson for us all to keep in mind. It takes a lot of work, I'm sure, but it has a big payoff. Another questions, were the readings sent via text message? It sounds like the app, well, yeah, maybe you can just explain to us a little bit about how the readings and the app, how it got all to the data analysts.
Okay, so there are two different apps that people use for this program. One is from Omron, which is the maker for the blood pressure monitor.
Okay.
So that's separate. So all of the readings for the week or for the month or for the whole 6 months, but broken into weeks, go into the monitor, but they're synced to your cell phone to an app.
Yeah.
And then from the app, you can transmit that information to whomever you like. You can send it directly to your primary care provider. You can send it to our program, and then we do analysis of it the way that we have. So that's one app. The second app is the My Data Helps app. And that's the one where you can collect the data from the wearable, the watches, the rings, etc. So for us, you know, if you look at the Apple Watch, you can collect practically everything that a person does. It was just way too much data. We narrowed it down to sleep, level of physical activity, the number of steps that people take, and then we inserted survey questions. So that's a separate app from the blood pressure monitor app. And so
Okay, that's called My Data Helps. Is that what
My Data Helps.
helps? Okay.
And so it collects information. You can segment it by week. And so we have the weeks of the My Data Helps app information and a week's worth of Omron blood pressure monitor information. And we're putting those together so that people can see during this week, my blood pressure was in this range, and I only had 4 hours of sleep average per night. So maybe I need to make some changes. Or, you know, I only had like 300 steps during the whole week. I need to get off the couch. So it kind of gives them a better idea of how the two are married.
Right.
Yeah.
Oh, that's cool. Do you happen to know if either of these apps are available in Spanish?
I do not know.
Okay, we can look into that through the apps, but someone else also asked, can anyone join this program from other states? Everyone wants to do it now. I want to do it too.
Yeah, well, we started out with just the DMV area.
Yeah.
And we had to expand it a little more because people had like relatives and wanted to do it with them. So we first allowed someone from Philadelphia to join the group. Now we have a person from Florida, I think as far away as Oakland, California in the group. So it's growing, and I think we probably will let other people into the program on a limited kind of basis to see how it goes at first. But yeah, we're open to it.
Well, hopefully this will be replicated all over the place because yeah, this should be happening in a lot of places, so it's not all on you.
Yeah.
And it sounds like you provided the blood pressure monitor for the participants in your program, right? Because
that's correct. Yeah.
you have your own. So
So they were donated to us, and then we allow the participants to keep them. They've developed sort of a routine with them. Some people who were from the first cohort who didn't join the second cohort said that they wanted to keep them, and they developed sort of a relationship with their monitor. And so it's good. We don't want to take that away from them. So they own the monitors after they've completed the program.
Right. No, that's fantastic. So I have a question about just quickly, you mentioned, people come in with such different views of digital literacy and health literacy. And did you screen participants in the beginning to know how many of them, how their skills were to begin with? That's one question. And then also how, it's complicated to teach people, especially if they have low digital or health literacy skills, to, take the blood pressure, use the apps and everything. So I'm wondering, like, how long or how many sessions did it take most people to really grasp that? Like, did it take a long time, or, and I guess it depends where they started out in their skills.
It depends where they started out. In the application, the online application, there was, we did insert a couple of questions. We asked something basic like, do you own a smartphone? There were some people who were still using like flip phones. And so we wanted them to have a smartphone at least, so that they were familiar with using apps, etc. We asked them another sort of technical question. I can't remember what it was off the top of my head. And we also asked them a few questions about just health-related questions to see how they would respond to them. How many sessions does it take? We're still teaching people. As many sessions as needed, even from people who consider themselves more advanced in terms of using technology, sometimes have questions. And so we have to go back to, for the My Data Helps app, go to some of the creators of the app and ask them questions so that we can provide our participants with answers.
Right. But it does sound though like that you were able to teach them to use it in order to, well enough to do the program. So that's great. Yeah, your education seems to have been done really well too. One person wants to know if there's a video link for the Lunch and Learn on understanding your medication. Seemed like it was really well received. And I don't know if you have these recorded but
the Lunch and Learns, the Lunch and Learns are usually recorded, but that actually took place during a small group session. So because people get raw and personal during small groups, we don't usually record the small group session. It just occurred to me last night that we should ask Abby to do that session again and record it, because the people who participated in it really learned a lot from it. So there may be a recording coming soon, but for that one we didn't.
Right. Okay. All right. Well, if it comes out, let us know and I can share it on the health literacy discussion list for people. Yeah, it's always nice to be able to use other people's well done trainings. And it sounds like the people really loved the games. We mentioned this before, but one person wants to know like how you created the games.
Oh, it was very basic. We do everything very basic because we don't have a huge budget. So we used, I believe it was either Canva or PowerPoint. I believe it was Canva to create a presentation. We used an app, or it was actually a website for games. I'll make sure that I include that with the information that I send to you. Where everyone can use their cell phone as a buzzer. And I'm telling you, we put this together brick by brick. Everyone can use their cell phone as a buzzer, and you post the question on the screen, and everybody has an opportunity to buzz in, and whoever buzzes in first is the first person to be able to answer. And then it just tabulates the score of the participants.
Oh, that's great.
So you can play a game show nationwide with people as long as they have a cell phone.
That's very cool. Well, yeah, so if we'll get that out to if you share the game site link, we'll add that with our information.
Okay.
So I think we have covered all of the questions. Yeah, just huge thank you to you, Cheryl, and your whole team for doing this project, and to you for sharing it with us today.
Sure.
Yeah, I hope that you can stay in touch, maybe through the discussion list, and let us know how the next cohort is going and what the data says. Is there a published paper on the effect
Not yet.
impact? No,
Yeah.
maybe someday, right?
Pretty soon, but not yet.
Okay, all right, because I'm sure that yeah, this is just a great thing to share with people all over the country to replicate it. So thank you so much, Cheryl, for being here. Thank you to all the participants. You asked great questions and we're really engaged, and yeah, I think that we're going to all start to talk about this more in our own network. So this was great to have. Thank you so much.
Thank you.
All right. Bye, everyone.